Hey everybody, this is Janice Wright from the Garrison Public Affairs Office. This week we're talking about something that's on the rise in our community, sexually transmitted infections, or STIs for short. We're going to delve right into how to keep yourself safe, how to get tested, and how to identify the symptoms. Now, being that this is such a sensitive topic, we want our listeners to be aware that this may contain content that may not be suitable for minors, so please listen accordingly. We're going to talk about all that and more on this week's episode of the Great Big Podcast. We are sitting down with representatives from the Army Public Health Nursing Center here at CRDAMC. They are here to discuss a very sensitive topic, which includes everything you need to know or want to know about STIs, which are sexually transmitted infections. And with that, let's get right into it. Won't you ladies please introduce yourselves for us?
Well, hello, everyone. My name is Ms. Harrison, and I'm an Army Public Health Nurse.
I am Major Suggs, and I am the Chief of Army Public Health Nursing.
And I am Miss Glenna Tucker, and I am the RN Supervisor for Army Public Health Nursing.
Oh, great. Well, it's nice to have you guys here with us. We are talking about something that is very prevalent, very important. STIs. Now, this is a very, very, touchy subject for a lot of people to discuss. So we'll start by talking about exactly what STIs are.
Okay, so STIs are infections that are sexually transmitted. And so they're kind of grouped together because that's the main way that you contract these infections. Most people are familiar with like chlamydia, gonorrhea, syphilis, HIV, all of those things fall under the realm of sexually transmitted infections. But there are other less common ones that do occur. But as long as you can get the infection sexually, it's an STI.
Okay. All right. So who would you consider is most at risk for STIs?
So we see the highest prevalence in younger people, ages around 17 to 24. But anyone is at risk for contracting an STI if you are sexually active. And even if you say I'm asexual or you use toys, you're at risk for contracting an STI if they're not properly cleaned.
Oh, understood. Okay. So what do you guys see right now that's trending that maybe it's, elevated levels of exposure as far as specific STIs?
Well, I feel like in our community, the things that's most prevalent is chlamydia and gonorrhea. That's what we see a lot of. Not to say that the others aren't as prevalent, but we definitely see people who come back higher for chlamydia and gonorrhea.
Mm-hmm. Are there symptoms that would maybe let you know that maybe something is not right and maybe you need to see a doctor?
Mm-hmm. There are many different symptoms. Some of it is penile drainage or vaginal drainage, different colors. It can be yellow, it can be greenish in color.
Okay.
Burning with urination, sometimes there's blood. When it starts getting a little more severe, there can be some abdominal pain. Mm-hmm. One of the most common things that are said is my partner has told me that they have an STI.
Okay. All right.
And I just wanted to add to that definitely while there are multiple symptoms that could occur, some people don't have any symptoms. And so I think it's very important if you know that you're sexually active, especially if you're not having protected sex, you're not using a latex condom. I think it's important to get tested frequently.
Okay. All right. I know that, like I said, the subject is very sensitive and a lot of people are embarrassed. What would you say to listeners who maybe have experienced the symptoms and that just are really don't want to go get tested or maybe are embarrassed or afraid to do so?
Well, we definitely want to encourage them to get tested. There are different ways that you can get tested. We want to be an avenue at Army Public Health Nursing, and we want people to feel comfortable to come to us and get tested. Not necessarily get tested, but so that we can run the appropriate labs that they need for testing. Know your body. Know when it changes. Trust your gut feeling. And if you know that you've been having unprotected sex, then it's definitely important to get tested.
Okay. Tell me or explain to our listeners more about what the testing process consists of.
So with the testing process, first the labs are ordered, and with that you will go to lab and there will be a blood draw, a urine test, and depending on the risks, there may be an oral swab or a rectal swab or even both.
Okay. Is there anything that the person has to do to prepare for these tests?
No.
Okay, so they just come in. They don't have to fast or anything like
No,
that?
ma'am.
Okay, so there is a blood draw and urine test involved.
Yes.
Yes.
Okay. And you also talked about some of the resources that are available for those who are non-military. Can you explain a little bit more about different locations and what they offer?
So the Killeen Health Department offers testing and treatment for STIs. You can walk into them. They service the entire population. They don't turn anyone away, but it's primarily geared toward those who are uninsured or underinsured. There is also a Temple Health Department that provides those same services, along with some in Austin. There's also the Kind Clinic, and that's located in Austin. And they provide, I believe, testing, and they also provide counseling services and medications for those who are HIV positive.
Okay. What is the timeline that you're looking at as far as waiting for your results?
So for CRDAMC, every place is different, but for CRDAMC and Army Public Health Nursing, it normally takes 5 to 7 days for us to get all the results back for all the different tests.
Okay. And you mentioned HIV testing. Is that testing different from the rest of the STIs, or is it the same?
So the HIV test is the blood draw. And so HIV and syphilis are the two things that we test for, and it requires a blood draw. And that testing process is simply like it is anywhere else, just like when soldiers go for their every 2-year HIV screening. It's the same procedure. What we want to see, and what our goal is, hopefully, with testing, is that we will definitely see a decrease in our number of positive HIV soldiers, or soldiers who are first-time positive. And so part of the process when you come into Army Public Health Nursing for that walk-in screening, we have you fill out a questionnaire. And with that questionnaire, just based on your sexual habits and your risk level, we may ask if you would like a referral for what we call HIV PrEP. And so for those who are not familiar with HIV PrEP, there are different medications out there that are designed to help reduce your risk of contracting HIV prior to an exposure.
I think I've seen that commercial.
You do. There are a lot of commercials out there for HIV PrEP. So that is offered through TRICARE. You can get it. You can you can ask your PCM for it, your primary care manager, or you can come to our clinic and we can refer you. CRDAMC does have a HIV PrEP clinic, and it just manages that medication regimen, because there are some lab testing and some follow-up things that need to be done. But that is available. It's free to all of our beneficiaries. And so if you are engaging in behaviors that place you at a higher risk for contracting HIV, like having multiple sex partners, participating in anonymous sex, if you are in a relationship with someone you know is an IV drug user,
Right.
It may be beneficial for you to be on this medication to protect yourself.
So this medication doesn't, it's not specified by being homosexual, heterosexual. It's for everybody who's sexually active?
It is for individuals who are at high risk. So there's certain screening criteria, but it's based on your behavior. So even if you were homosexual, but you're homosexual in a monogamous relationship and you both are negative, there wouldn't necessarily be a need for you to be on HIV PrEP.
Okay.
But if you are someone who likes to use the services of a sex worker, then you are definitely at high risk.
Okay.
And you should definitely consider HIV PrEP.
Right. I know that specifically HIV can be life-altering. What I want to know is, how does an HIV diagnosis affect a soldier and potentially affect their career?
So an HIV diagnosis can affect their deployability. There is medication out there now to help with their viral load, to get that viral load suppression. And they follow up with infectious disease. That is routinely done. Typically, once they're stabilized, that's every 6 months that they're doing a visit with infectious disease. The regulation is constantly changing, and you can now have a full career with HIV. You can go green to gold.
Right.
So it is continually
great.
changing.
So it is not, it's definitely not considered the death sentence that it was maybe 10, 15 years ago. The treatments are progressive in technology, and things have progressed in that now you can live a normal and progressive and abundant life even with that diagnosis. So how does Fort Cavazos kind of come together to support soldiers or family members that, you know, may have that diagnosis?
So at Army Public Health Nursing, we are aware and provide case management to all service members, active duty service members with an HIV diagnosis. And we will also provide that to any retirees or dependents if they want to. If not, they can opt to go into the private sector for that case management. But during that time, we kind of ensure that they get their labs, that they keep their appointments with infectious disease. And even though you can have a full 20-year career with an HIV diagnosis, that's provided you stay healthy. That's provided that, you keep your viral load low. It does put a little bit more scrutiny and restrictions on kind of your conduct and behavior. Having
Absolutely.
Unprotected sex. It goes against, you get counsel that you have to have protected sex, right?
Okay.
So there's a little bit more, involvement in your personal life that's command driven versus just it being your personal choice. And so what we would prefer is that you never have to experience that aspect in your military career. Though there are many things that the Army has put in place to support soldiers and family members who have an HIV positive diagnosis, I think the better option is that you never get diagnosed.
Absolutely.
Or never become positive. If you are positive, then definitely get tested so that you can get treatment. The goal and I guess the main way that people live long, productive lives is early detection and getting placed on medications early so that your body has the best chance it can to continue to fight off that virus and for you to remain healthy as long as possible.
Because you can be asymptomatic and have the virus.
Most
Absolutely.
definitely.
So how long can the virus live in your body without you having any symptoms or without you knowing?
Years. I mean, it varies from person to person, but you can go undetected for years before your viral load, that HIV virus just replicates so high in your body that you start to get opportunistic infections, which are like infections that people don't normally get, but because that virus has suppressed your immune system so much, you start to get diseases that you would normally be able to fight off.
Can you explain or give a few examples of what those might look like?
So let's say something very common, oral thrush that babies normally get. People who have HIV, who have a very high viral load and a very low immune system, in a normal adult, like a 30-year-old, they could develop oral thrush. Very unheard of, like very unusual in the U.S. for an adult who doesn't have some type of immune system issue going on to have oral thrush.
Wow.
Right. No one dies from the HIV. They die from the diseases or the infections that you
because your body can't fight off anything.
Because your body can't fight them off.
Okay. Yeah. Understood.
And I'd just like to say with HIV, the same ways that you're at risk for getting HIV, if you are getting other STI, the people are like, well, I'm not messing with anyone who's HIV positive. I know it because we get tested every 2 years. A lot can happen in 2 years, first and foremost.
Absolutely.
But if you are able to contract chlamydia, gonorrhea, then you're open to anything. So you can't be like, oh, it's fine, it's just chlamydia, or it's fine, it's just gonorrhea. Well, the same way you were exposed to chlamydia, that person could have had HIV. And a lot of times, if you have chlamydia or gonorrhea, you have a higher chance of contracting HIV.
Because your body, again, is your immune system has been compromised.
Your immune system is already trying to fight off that one STI, and it makes it more susceptible for you to contract another one. So getting tested and getting treated is very important.
So I can imagine that, someone finding out that they are diagnosed with an STI can be very mentally challenging. So how would you suggest that a person, kind of stay on top of that or get around feeling depressed or saddened by it?
Well, I think the number one thing to do is to empower them and let them know that they made the right decision to first and foremost get tested. That's a responsible choice. Mm-hmm. And so there's, like she said, there's no judgment. We encourage them, if you know that you've been in a situation that puts you at higher risk, or you've had that unprotected sex, or maybe you did have sex with someone who has multiple sex partners, or you're engaging in anonymous sex, it's important that you say, I do want to get tested, and just feel comfortable coming in to get tested, knowing that we're not going to judge you. We simply want to test you so we can stop any community spread that could happen.
Absolutely.
And I would just like to add, people end up with STIs sometimes as an innocent victim. So if you believe you're in a monogamous relationship, but that's not what your partner believes, and they're, being less than faithful to you.
Right.
Unfortunately, you don't have to be out there doing things that are of higher risk. You could consider yourself being 100% safe and still end up
getting infected
with an STI. And so our goal is, it's not to say point fingers or to judge people as to how they ended up contracting an STI. It's to educate and empower them so that they can protect themselves, so that they don't end up with a reinfection. And so what we want is for everyone to get tested. Even if you think you're doing all the right things and being safe, there's no harm in getting tested. Then if you get tested, all your tests will just be negative.
Right.
But You'll know for sure.
Absolutely. Mm-hmm. Earlier you mentioned precautions, ways to protect yourself. So what are some of the most common ways?
Well, condom use is definitely one of the most common ways, but there are male condoms, there are female condoms. There are condoms that are designed if you engage in anal sex. There's dental dams if you engage in oral sex. Mm-hmm. So there are definitely ways out there, affordable ways, some less affordable, like the female condoms are definitely more costly than male condoms. Mm-hmm. But at Army Public Health Nursing, we give away free condoms, male condoms. So we have them on our counter at the hospital in paper bags. So if you want to walk by and just pick up a bag, they're there and they're available. No questions asked.
So I know that in discovering, if you discover that you have an STI, sometimes it may be very difficult to discuss that with your partner. So what advice do you have for that?
Well, when it comes to the discussion with your partner, I say if you're comfortable enough to engage in sex with someone, if you're comfortable enough to allow them to either insert something in your body or you insert something in theirs, you should be able to have a conversation with them about their sexual history, about STIs, about getting tested. If you suspect you have an STI, talk to your partner about it. We've encountered cases where people have entered into new relationships, and it's not that one person has been unfaithful or something bad has happened in the relationship. They were just unaware that they had an STI because it can be asymptomatic until they were with that new partner, and that new partner started developing symptoms. So, part of having sex and connecting with people is just a human response, right? That's something that we all very crave natural in our lives. It is very natural. So there's no shame in that. But when you reach that level in your life where you're ready to engage in that type of relationship with another individual, you also have to be ready to have adult conversations.
Those hard conversations.
Because we all know we're not here to talk about pregnancy, but if you're going to engage in activities that can bring about a whole nother life,
absolutely,
then you definitely need to be mature enough to be able to talk to your partner about sex and having safe sex.
And would you encourage people who are sexually active and who are maybe thinking about or contemplating being sexually active with a new partner to maybe get tested beforehand, so that
definitely.
Both of you understand where each other is and you know each other's status, so that can make it a lot more comfortable?
Most definitely, 100%. Like, that is I think the mature route to enter into a relationship. But everyone's relationship is different.
Absolutely.
And so I know that a lot of people may be in these polyamorous relationships now.
Absolutely.
And so you should have a discussion about testing.
Mm-hmm.
If you agree that you're going to see people outside of your relationship, then you should discuss, hey, how are we going to keep each other safe?
And how often do you advocate testing?
Well, it really depends on your sexual practices and your risk. So if you are entering into a new relationship and then you could get tested then, and you feel like you're completely monogamous and it's just the two of you, there may not be a need for routine testing. But if you are someone who utilizes dating apps or engages in anonymous sex, we should probably see you more frequently, maybe monthly, just depending on your behaviors and how often you place yourself at risk. If I test today and I have a new sexual relationship with someone tomorrow, my test today means nothing about my status tomorrow, because I could have been infected that very next day. So it just depends on your sexual behaviors.
Absolutely. Okay. So is there any programs that are in place at Fort Cavazos to help educate soldiers and their family members?
We are working on opening on Monday a walk-in clinic for STI testing. So from the hours of 7:30 to 11:30, you can walk in, say you want testing, and while you're there, you will fill out a questionnaire. Our nurse of the day will come out, review that questionnaire, will pull you back in, and will provide counseling and education before you leave on things to watch for, what to expect, and education on ways to protect yourself.
Okay. So just to reiterate that for our listeners, so January the 8th, and what were those hours one more time?
7:30 to 11:30.
It's Army Public Health Nursing. We're located on the first floor in the grasslands section. As soon as you walk in, so if you're familiar with where the pediatrics hallway is, right there on that corner.
Okay.
What we wanted to do is just make it easier to access.
Right.
You can always make an appointment with your primary care provider at CRDAMC, whoever you're assigned to, but sometimes, competing with other sick people, it's hard to get an appointment. And
Absolutely.
That's why we're like, if people can just walk in. If you want to get tested, that's something quick, that's something easy that we can do. Get you tested, and if necessary, get you treated.
Okay. So I know, like I mentioned earlier, this is a very sensitive topic. Why do you think that it's important to actually come on today and get this information out to the listeners?
I think for our society for such a long time, sex has been taboo. You do it behind closed doors. You don't talk about it.
Absolutely.
And a lot of times, even when you go to your doctor's office, you're not even asked about your sexual health.
Right.
And sometimes you may feel uncomfortable bringing it up, being that it is such a personal thing, especially if you don't feel in your mind that your sexual behaviors fall in line with traditional accepted sexual roles.
Right.
And so what we want to do is first start talking about sex. That's how we all got here. That's how we're all going to continue to populate this earth, is through sex. It's normal, it's natural, and people are going to do it even if we're not talking about it. We just want people to be able to do it safely. We don't judge how you choose to engage in sex. Like, that's not our place to judge. But if we can have that conversation with you and tell you how to do it safely, how to keep yourself safer, that's it. How you choose to enjoy life is on you, but we want you to enjoy it safely.
So we all know that there's overall a negative stigma, no matter what you are, or no matter what you've been diagnosed with. Even the fact that you are trying to get diagnosed to prevent getting an STI, there's a negative stigma. What can we do to get past that?
Well, that stigma, I think, first I'd like to just say it is holding us back. And so we have to get rid of it. And the best way, in my opinion, to get rid of a stigma is to talk about it. And so we need to continue to have the conversations about sex and sexual health.
Absolutely.
And we need to have these conversations without judgment.
Absolutely.
Just open conversations so that we can find ways to keep ourselves safe. One person with an STI in our community is one person too many.
And I think we have to understand that, there's a lot of myths and facts out there about STIs.
Absolutely, there are.
And so some myths do need to be debunked. Just to name a few, some people think that oral sex is safe sex. That's definitely a myth. Oral sex, people who engage in oral sex can contract different STIs. And so we want that to be out there.
Right.
Condoms don't also necessarily mean safe sex either, because there's ways to appropriately put on a condom.
Right.
And so we encourage everyone to educate themselves on those appropriate ways to put on a condom. To make sure that you're using a latex condom. Mm-hmm. It makes a difference in the different type of condoms that's being used.
Okay.
And different things, just like if I pee, douche, or clean myself after sexual intercourse, it lessens my chance of getting an STI. That's definitely a myth.
Wow.
Anytime you come in contact with someone and you're not properly protecting yourself, you're at risk of getting an STI. So that's important to put out there as well. And our goal is, I know we've harped on the fact that you can show up to Army Public Health and we'll get labs ordered. But if you're just simply someone who wants to know the correct way to put on a condom, you want education on how to protect yourself. You would like to know better ways to start the conversation about safe sex with your partner.
Right.
We're there to accommodate all of those things.
Absolutely. Well, before we wrap it up, no pun intended, well, maybe pun intended. Is there any other advice or suggestions or information that you'd like to put out for our listeners today?
Well, I would just like to add, not only do we do the walk-in STI clinic, but we will do unit education. If any units want us to come out and do STI education, we will come out to your units. We will come out to your events. All you have to do is just contact us at Army Public Health Nursing, and we will be there. I do have to put the disclaimer, you have to be a TRICARE beneficiary. But if your partners are not, we will find them local resources if they don't have health insurance so that they can get tested and treated if necessary. But yes, TRICARE beneficiaries can walk in 07:30 to 11:30, Monday through Friday.
Okay. Well, we really appreciate you guys being here and talking so openly about such an important topic.
Yeah, thank you for inviting us.
Thank you.
Listen closely.
Hey, specialist, looking sharp in those OCPs.
Get a little closer, Private. I don't bite.
Now what do you hear?
Hey, specialist, looking sharp in those OCPs.
Get a little closer, Private. I don't bite.
Know the difference between casual comments and sexual harassment. Unwanted sexual advances are never tolerated. If you see it or experience it on or off post, it's up to you to take action. This is our Army.
Well, I think this episode of the Great Big Podcast is probably, for me, one of the most informative and probably one of the most sensitive, being that we talked about STIs or sexually transmitted infections, which are on the rise in the community. So it was a conversation that needed to be had.
Yeah. Well, good. I'm glad that CRDAMC was able to come in. And hey, everybody, this is Samantha Harms with the Garrison Public Affairs Office. Glad we were able to have them come in and kind of talk about all that. And I'm glad to know that it was one of the most informative for you. I'm excited. Is that the most informative you think of the whole time you've been doing this?
I think so. I mean, it's a subject that is not talked about openly because of negative stigma, because of embarrassment, and the professionals from CRDAMC want to make sure that stigma is that we take that away so that people are more likely to seek treatment, seek testing, put in place precautions to avoid testing positive for any of the STIs. So it was a very, very interesting conversation, very informative.
Awesome. Good. Well, I'm glad to hear that. Well, that's great. Well, obviously that is happening out in Central Texas community.
It is.
But we've got a lot happening here on the Fort Cavazos community. Eric.
The whole time I just didn't have anything to say, so I was just
that's fair.
Wait, I was like double dutch. I was waiting for my time to jump in.
Ooh, there you go. Well, it's your time. Time to shine.
Oh, yes. Now it's my time to shine. So due to a annual inventory, the Fort Cavazos Exchange will have a delayed opening on Sunday, this coming up Sunday, which is the 18th?
21st of January.
It's the 21st?
It is the 21st.
Tomorrow's,
Wait a minute.
Tomorrow's the 17th.
We just had the 1st of January, though.
Yeah, I know. It'll be the 21st on Sunday. Yeah.
Every year, last year, we had the same problem. The months were just going by super fast.
It goes by.
And guess what? It's going to happen again next year.
I know, but it just feels like it goes by.
She's letting you know really early in advance.
She's letting me know because I'm going to continue to I'm going to continue to say this.
Yeah, I know.
But so the Fort Cavazos Exchange is having a inventory, their annual inventory, meaning they're counting everything, making sure they got everything, and they're doing that. So just be prepared that this Sunday, the 21st, blows my mind. There's going to be a delay in opening. For all the up-to-date information, including when the exchange will be open again, follow their Facebook page at facebook.com/Cavazos Exchange.
That is correct.
Don't feel bad, Eric. I do feel like this month has gone by fast. So you're not alone. You're not alone.
Exactly, Sam.
I didn't. Oh, Sam, I didn't do nothing. I'm just
saying.
here.
Also, did you know? While we're questioning my intelligence, not a real good segue.
No.
But, so, did you know that there's a program on Fort Cavazos that if you want to become a physician, the Army offers
physician assistant.
Is that the same? Is that not the same?
No, it's not
it
the
is
same
not
thing.
the same.
It's very different.
It's very different.
Yeah, we've actually had the physician assistants come on the podcast in the past.
Where was I at?
I don't know, but we've talked about what a physician assistant does.
Clearly, I need to go back and check out.
It is a very,
Yes, it's an important thing.
Yes, but it is not the same as being a physician.
Definitely not.
Well, if you're interested in becoming a physician assistant, the Army offers well-qualified officers, warrant officers, and enlisted soldiers an incredible educational opportunity to become a physician assistant through the Inter-Service Physician Assistant Program.
Yes.
The IPAP is dedicated to the education of students who strive to become competent and caring providers for primary health care services under the supervision of a licensed physician. Well, that just tells me everything I need to know because it tells me that they are licensed physicians. They train under
they assist.
So yes, as Sam said, just as important, just not a physician.
Correct.
Yeah. Well, if you're interested in becoming a physician assistant, which is totally different than a physician, attend an in-person brief at 9 a.m. and 2 p.m. Thursday at the Soldier Development Center for more information about this program and the application process. That's all you need to know.
Yeah.
If you want to be a physician assistant,
yes,
which is totally different than a physician.
Yes, it is.
Yes.
Okay.
Yes, this is open to all soldiers.
All soldiers.
Yes.
I think
All
that's
soldiers,
pretty
officers, and warrant officers.
Reserve.
That's pretty awesome.
Active. Yep, everybody. You were welcome to join. You can go and learn all the information you need to know. And as a matter of fact, we're going to have the physician assistants here at Fort Cavazos. We've got some graduating in February here.
Coolio.
Very exciting for them.
So I guess I'm going to have to go do a stiller on that now that I've put my foot in my mouth that I don't know what the difference is.
You are in luck because our good friend Rodney Jackson with CRDAMC already did it. That's how I know.
Hey, I'm smiling if you guys don't know.
In a future edition of the Sentinel. So
Coolio.
Check out the Sentinel on that.
There you go. So one of the great things I love about the Great Place is all the opportunities.
Yes.
And speaking of opportunities, the scholarship application is now open.
Yes, it's been open for a while, but Yes. I think you did the interview, right? For the scholarship fund. They were just on.
I think I did do an interview for the scholarship fund.
So
yes.
clearly I'm not the only one who doesn't remember what goes on here.
Apparently I'm the only one.
There's a difference. There's a difference, between a touch of forgetfulness.
Ooh. Ooh.
So anyway, the Fort Cavazos Family Scholarship Fund is now accepting applications for the 2023-24 scholarship year.
Yes.
So scholarships are available to high school seniors and military spouses. For all eligibility requirements and to apply online, visit fortcavazosscholarship.org/apply.
So that means that my daughter in 2 years, when she becomes a senior.
Yes.
Got it.
Yes. And so you guys know, the deadline is February 16th, which Eric now realizes will be here any second.
Way quicker than what I was expecting it to be.
Yes, it is at this point less than a month away.
Yeah, it is.
For February 16th? February 16th, yeah. Less than a month. So for
right after good old Valentine's.
Yes. So for folks who Valentine's Day and Galentine's Day, the day for the gals.
What?
Yeah, Galentine's Day.
I like
You've never heard of that?
I have never heard of that.
I love it.
Yeah, it's from a very popular TV show. That was about local government. I'm just gonna broadly talk about what this show is.
Yes.
Without actually saying yes. With a very spunky woman who's very dedicated about local government. She starts at Galentine's Day, so it's the day before Valentine's Day, where you get to celebrate with your ladies, your friends, your gals,
your gal pals,
your gals.
Oh,
yes,
we need to adopt that.
Yes,
that's cute.
It's
I
really
like
nice.
that.
Yes.
I can get with that.
Yeah,
Okay.
I love it.
There you go.
All right, so while we're on the learning curve,
you
can learn some new recipes with HEB USO.
Oh yeah.
Yes.
Yes.
I've been to one of those.
Yes, you've both been to one of those, actually.
I have.
Yes.
It was a live cooking demo. It smelled amazing, and the food tasted great. It was live. So the United Services Organization Fort Cavazos is hosting a demonstration kitchen event with HEB from 3 to 4 p.m. Tuesday at the USO here at Fort Cavazos.
Nice.
So if you guys want to attend, you can come and actually see them prepare all of the fresh ingredients. And most importantly, you can taste it. Mm-hmm. And you might even get to take some of those ingredients home to prepare it for yourself and your family.
Nice.
Wasn't one of the things with that, if I'm not mistaken, is all that stuff, they can be made in the barracks room. I think that's what it was.
Could be made you couldn't cook in the barracks when I was in the barracks.
Well, of course, you were in the barracks a while ago, but now they have little kitchenettes in there. We're going back and forth all day.
It was just yesterday. What do you mean?
No,
what are you trying to say, Eric?
I think everyone's a little testy today. I like it.
But no, they have like little. What do you call those things?
Like
hot plates?
Not hot plates. I don't want to call them hot plates, but they're built in.
Like a 2-eye burner.
That's what they're called. I want to say when I went that they said all of these can be prepared on those 2 burners. Like it's very
you have
minimalist.
the little it's what people do like on social media when they're doing a cooking demo. They always have either 1-eye or 2-eye burner where they're actually cooking, but it's like really small.
But I want to say when I went, that's why they started doing those, is because it's very simple and all the ingredients are simple and everything that you need is simple enough that you can do it on those 2 eyes.
That makes sense. I like that.
I'll still burn it, but
Right.
Yeah,
well, whatever.
That's okay. Yeah.
Well, if it's allowed, I'd say it's awesome.
Yeah,
It just
go for it.
I'm just not sure about that. I'm not sure about the guidelines for cooking in the barracks. You guys, please find out.
Let us know
before you decide to make a meal.
Yeah, that's
in the
a good
barracks.
idea. Yes.
Or but it'd just be on the back end and
right.
Whatever.
Anyways, for this
moving
event,
on.
No registration is required, correct?
No registration is required. You can just show up and enjoy.
And who is the event open to?
Yeah. This program is geared towards our active duty service members and their spouses. An HEB chef will show how to make a meal, taste it, let them taste, and all that good stuff.
Great. I love that.
And there will be giveaways.
Ooh, we love a good giveaway.
Always loves a good giveaway, especially
the best part.
Yeah, we love a good giveaway. Well, great. I love that. Okay. Anything else that's happening here? Because I have one more thing. I know on social media, we've already announced this. I'm excited for not this week's paper, but next week's paper, we're going to be talking about the hop. We have announced the winner and the artwork. We released what the artwork looks like for the Cavazos connector design that will be going on all the buses. Very exciting stuff. So for people
it looks very snazzy.
Yes, for people who have not seen it, definitely follow us on Facebook. Our little @ is at Fort Cavazos Army on all social media, and you can see it there and let us know what your thoughts are. Yeah. So I'm excited. We're going to talk all about that in next week's paper as well. So
love it.
For people
Look
who
forward to it.
want to know some inspiration behind it, that's the place to be. So
Who's writing that story?
I think you are.
Oh, that is correct. I am writing that story. I knew that already, guys.
Yeah.
I just was
You're testing me.
I was testing her.
Mm-hmm.
Yeah, just trying to slide one by her.
Yeah, it didn't work.
It did not.
So last but not least, don't forget to take advantage of hourly care.
Yes.
So the Meadows Child Development Center now offers hourly care from 7 a.m. to 6 p.m. weekdays. The cost for care is $8 per hour for up to 15 hours per week. Reservations are required, and children must be registered with Child and Youth Services. For registration information or to schedule a registration appointment, parents should contact Parental Central Services at 254-287-8029 in Building 36,000 Shoemaker Lane.
Nice.
Yes. Also, parents are required to complete an online hourly care orientation before making their first reservation. A 2-hour no-show fee will be assessed for patrons who fail to show or fail to cancel their reservation at least 24 hours in advance.
Okay, great.
That's pretty cool.
Yeah, that's awesome. I love that.
That always helps. I remember childcare. It was expensive. I do
Yeah,
not have fond memories of it.
People always say that.
And you almost have to pay top dollar because it's already, really overwhelming having someone else care for your children when they're small. So, you kind of are forced to pay whatever you need to pay to get the best care. So this is absolutely amazing.
Yeah, absolutely. This is a struggle that I don't know yet. So,
well, just think about it of when you have to go out of town and you have to put the doggies.
That's true.
In doggy tables.
It's already expensive too.
And it's
very it is like it's similar to that. I have never had to hire anybody to watch my dog. My sons always step into that role, but I'm imagining at some point I might have to do that, and it's kind of scary because I don't know who's good, and I don't know if I want to trust anybody else with the care of my dog. Are they going to treat my dog with the kindness and love that I'm going to treat them with? So that's a scary thought.
Yeah.
But
the same goes for children.
Yeah, it's the exact same for children.
Well, it's a lot more serious. Yeah. You're running into, you don't want to see Mama Bear come out if you're not treating her cubs the right way. That's how I feel anyway.
But Meadows Child Development Center, it's great.
Absolutely.
Like, if you have the opportunity, go
Top
check it
tier.
out. And if you don't already have your kids in one of the CDCs on the installation, you can go and check them out before you, especially for those who are just getting here. Go check them out. Go shop around to see which ones fit your needs and which one's close to your work, and which one fits your needs and suits you and your kids the best. But nonetheless, make sure you do your research. That's what we're getting at.
I love it. Great.
That pretty much sums it up.
Yeah, I think it does. Yeah.
Do your research. Great advice.
It's good advice for everything.
Yeah.
Yes.
I wish I would have done that about these dates, because dates are just going by. Anyway, does anybody have anything going on this weekend?
Oh my goodness. No, I don't have anything.
I'm curious, what is the weather going to be like this weekend?
It doesn't. No one knows.
It won't be like this, is it?
I think
it won't be like last weekend.
Tomorrow, I think later this week, but tomorrow, Friday, I think it's supposed to start to warm up, but I don't think it's going to be above the 50s. I think it's
50s.
But
40s,
tomorrow
50s-ish.
it's supposed to start warming up, and then we should be good after that.
Yeah, I think Mother Nature played a cruel joke, giving us the couple of days of lovely weather and then giving us the frigid Arctic temps.
Yeah. Yeah. Well, you're a Kansas City Chiefs fan. Did you watch the game?
I did.
Did you see the
frozen
famous,
stash?
Yes. Frozen stash?
I looked at it, but I didn't want to look at it, but I couldn't look away
because
it was just staring at you in your face, and I'm like, is he gonna wipe it? Is he gonna melt it?
He just left it.
He just left it.
I know.
I don't think he was like, hey, I'm not focused on that right now. They got to win this game. It is what it is.
Yeah.
It'll melt when I go inside the locker room.
It was a
I
horrible
watched
game.
all of
It was
the
a good
playoff games.
Horrible
It
game.
was a good game.
They were all good. All the playoff games.
Once the
were good.
Cowboys lost, I stopped watching.
That was the best game. I'm a Packers fan. So
I stopped
that was a
watching
great day
all of
for
them after
me.
that.
I also like the Steelers, so I was sad to see them lose.
Yeah.
Tragic.
Yeah.
Well,
So here we go into into the next round, and I'm just praying my Chiefs stay alive. Come on, Chiefs,
Yeah.
let's go.
Yeah.
All you Chiefs fans out there, let's go. Let's band together. Prayers for the Chiefs.
Boom.
Don't
Just
you
because
dare.
you're upset.
Don't you
I
dare.
get upset every year
team.
because they do this to us anybody who's been a Cowboy fan and has for a while, they know every year they do the same exact thing. It's just like, oh, we're almost there. Then we just poop the bed.
Was it me or was
yeah.
Jerry Jones especially emotional?
He was so upset.
He was so upset. Yeah.
I don't think Mike McCarthy is going to last very long there.
Yeah, I think they're already looking for his
Yeah,
replacement.
I think so too.
He was upset. I saw a video where someone made him cry, and it's just like,
Yeah,
probably
that's
how
the
he
one
feels
I
inside.
saw. I was like,
Yeah,
okay, he was
yeah.
emotional, but he wasn't that emotional, was he?
No.
I don't think. Did he actually cry?
No,
I
he
don't
didn't
know.
cry. He
Yeah.
just was sad.
I just expect to see a lot of
Two Texans
changes. The NFL's gonna, get shook up a little bit at the end of this season
Yeah.
and going
sure.
into next.
So I guess that technically qualified as sports with Sam. It did
Where
qualify.
you told me about sports. It
Yeah.
did. Yeah, we brought
Yeah.
that back. Sports
Yeah.
with Sam.
Yeah, we
Where
did.
The two of you tell me about sports. So.
Yeah.
Yeah.
All right. Well, I think that's all we have. We've been rambling a little bit, so we're
Yeah.
gonna get off of here so you guys can go do other things. Hopefully, go do PT or get the kids ready for school. Whatever you guys got to go do. Just
I mean,
whatever.
people can listen in the afternoon.
They
Yeah,
can.
they can
Or
listen
could be-
anytime they
could
want.
be getting off work
They
or
could be
going to the
driving
gym.
home. Yeah.
They could.
What he's trying to say is we won't hold you.
That's what I'm saying.
But thank you for listening. We appreciate you.
Yep.
Have a good week, guys.
Bye.
Bye.
This podcast is a U.S. Army Garrison Fort Cavazos and Fort Cavazos Public Affairs production. Have a question or want to share some of your wisdom with us? Drop us an email at fortcavazos@gmail.com. You can follow us on Facebook, Instagram, and Twitter at Fort Cavazos Army. And as always, be sure to leave us a review and subscribe wherever you listen to podcasts.